WA has reported another 2,137 COVID cases overnight, but the number of people in hospital with the virus has dropped slightly to 21. The decline in case numbers from 24-23 on Thursday comes a day after WA's hard border was dismantled and around 5,000 people jetted into Perth Airport from interstate and overseas on the first day of quarantine-free travel. In a further encouraging sign, none of the COVID patients in hospital were receiving treatment in intensive care, and there were no reports of further deaths. The number of deaths during WA's Omicron outbreak remains at 2 after a woman in her 80s, believed to be from the Great Southern, died with the virus earlier this week. The state's active caseload now stands at just under 10,000. Your cookie settings are preventing this third-party content from displaying. If you'd like to view this content, please adjust your cookie settings. To find out more about how we use cookies, please see our cookie guide. By the same point of its Omicron outbreak, 10,000 active cases, South Australia had 74 in hospital, 4 in ICU, one of whom was ventilated. Queensland had 11,600 active cases on December 31st, at which point 64 people were in hospital and 1 was in ICU. As of Tuesday, 88 people with COVID were being monitored in their own residences as part of the McGowan government's COVID Care at Home program. A breakdown of cases by regions reveals COVID is beginning to surge in both the Goldfields, which reported 23 additional infections, and the Southwest, 42 new infections. Every other country region also reported new cases: Pilbara, 17, Midwest, 10, Wheatbelt, 8, Great Southern, 4, and Kimberley, 2. Some 14,553 people were tested at PCR clinics on Thursday. The third dose vaccination rate among West Australians aged 16 and over is now 66%.